everyone. Thank you for joining us today. We'll be starting very shortly. We're going to give people a little more time to join, and we'll be back in just a moment. Good afternoon, everyone, and good morning. I see we have someone joining us from Australia. Good day. So my name is Phalo Kaneen. I'm a hand therapist at our Park Slope office in Brooklyn, and I'm director of the hand therapy program. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. We appreciate you taking the time out of your busy day to learn with us. Now, for those of you who do not know who we are, SPEAR is a private outpatient practice that's been around for over 20 years, and we currently have 25 locations all over the New York City area. In our clinics, we strategically go above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We're here for you in whichever way makes you feel most comfortable. If you are looking for individualized care, please reach out to us at your convenience, and we'll get you set up for an appointment right away. Now, we're really excited to be with you today to discuss common wrist injuries and how to treat them. We will be discussing wrist anatomy, some common wrist diagnoses, as well as treatment methods to address and improve these conditions. Now, as part of our session today, we will be talking through and demonstrating some of these exercises, and we welcome you to follow along to practice, as long as you feel comfortable doing so. Now, please note, if you're experiencing any pain while performing any of these, definitely stop and reach out to us or a doctor so that we can support you. Now, as you can see, some of us are coming to you live from our home, some through at our offices. And although we do not anticipate any technical issues today, please be patient with us should any issue arise as we navigate working through this technology. Now, throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find that where that is, please take a moment to hover your mouse at the bottom of your screen, and you will see Q&A option pop up. This is where you will put questions, and we'll do our best to address as many of them as we can during the webinar. It is best to put questions in the Q&A. If you put questions in the chat feature, we will likely be unable to get to them during the webinar. Now, for those of you who are watching through the YouTube live, we are monitoring those comments as well. And so please feel free to type your questions in there. Now, lastly, there will be times where multiple panelists are on the screen. For the best viewing experience, please select Gallery View, and that's on the top right corner of your Zoom screen. So you'll be able to see multiple panelists at one time. So now let's talk more about our goals for the day and what we will be covering. So we're gonna review some wrist anatomy. We're gonna explain some common wrist conditions and their prevalence. And then we're gonna discuss treatment methods for wrist pain and lifestyle modifications. Okay, now before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone on the screen now. So our presenters today are two of our hand therapists here at Spear, Courtney Nilson and Ayelen Lee. Now they're both OTs, and Courtney works out of our 84th Street location, and Ayelen works out of our Chambers Street location. Hi, Courtney. Hi, Ayelen.
Hi, guys. Hi.
And lastly, but not leastly, we have Kathleen O'Donnell-Pickard. She is also an OT, and she works out of our Spear Live office, and she specializes in telehealth. She will be helping us with the answering of your questions in the Q&A session. Okay, so let's get started. All right, Kathleen and I are going to say goodbye for now, and Courtney and Ayelen are going to take it away with some info on common wrist injuries and wrist anatomy.
Hi, everyone. Like Phalo said, I'm Courtney, and I'm an occupational therapist that works on the Upper East Side. Today, we're going to be talking a couple different injuries that happen with the wrist. And the first one that we wanted to talk about was something that's called Quervain. So it's this interesting word that people usually don't know how to pronounce. And what is it exactly? Typically, you'll have some pain located on the thumb side of your wrist, kind of right below that thumb. And what's going on, if you can see the picture there, is that you're having some inflammation of the two tendons of our thumb that helps us kind of bring our thumb out and around. So this kind of motion usually can be a little painful for that. It's typically caused by a repetitive motion. So a lot of the times it's referred to as mommy's thumb or texter's thumb or gamer's thumb because of all the different motions that people are doing. It's like a new mom constantly going to pick up her child, or someone who's on their phone scrolling, or if you're on the game console playing an intense game, those can typically cause some of this symptom to happen. Or honestly, sometimes I've seen it also happen when you have a traumatic fall and you go and catch yourself by putting out your hand. That can sometimes also trigger this condition. And so on the next slide, we'll talk a little bit about what are the symptoms of D. Quervain's. Pain usually is the number one that people come in. And like I said, it's this pain kind of on this thumb side of the wrist. And typically I see that people have most pain when they're going to move their wrist down because of their stretching out all those muscles and the tendons that run up along that wrist. And there's some tests that we can try to see if we think that this is really going on or not. And like Phelos recommended in the beginning, these are things that typically a physician or a therapist should do. I wouldn't recommend doing some of these things, especially if you're having pain. So I'll go ahead and talk a little bit about each of them. One is called the Finkelstein test, and then one is called the What test. So I'll go ahead and demo those for you guys. So for the Finkelstein test, what you'll do is you're going to take that hand and put the thumb into the hand and wrap those fingers around it. Once it's in that position, you then try to move up and down. This is typically uncomfortable for most normal wrist. And so usually the sign of that you have D. Quervain's is a very sharp, intense pain when you go down into that motion. There's another test called the What test that we do sometimes. It's when you bring your arm nice and straight and you bend that wrist and you bring that thumb out. And then the therapist or the physician would tell you to resist the motion trying to push you down, and you just hold it, hold it, hold it. And that would again elicit a very sharp, intense pain located on that thumb side of the wrist. So now we know what it is and how to test for it, but what should you do if you think that you have this? And so we'll talk about that on the next slide as well. So usually people don't like to hear the first part of this. Is typically the best way to help the pain is to immobilize it and to stop whatever motion you're doing that is causing the pain. So typically either an occupational therapist or a specialist of hand can make you a splint, or you'll get a brace from your doctor that goes all the way up into that thumb. And it goes all the way down into the wrist just because that's where all the muscles are going that control that thumb. And it prevents you from being able to use that thumb as much as you were before, but it does really allow those tendons and muscles to relax, which is really what they need in order to you to start being able to use your hand again. Some other things that I recommend is modifying whatever activity you're doing that is causing that pain. So whether it be a poor ergonomic setup at home, or if we're using our phone a lot with our thumbs, perhaps using our other fingers instead. If you're picking up your child in this kind of motion, that scooping motion, to really try to do both hands and kind of bring those thumbs in. Those are just activity modifications that we can do, but also if you're having a lot of pain, I do recommend maybe some ice to help decrease the inflammation. Another thing that is really helpful is just getting a little ice cube and kind of running it along that thumb surface of your arm. And then once you've been immobilized, typically the immobilization phase can vary depending on how severe it is. It's anywhere from like 3 weeks to 4 weeks. So after you've done with that, you've been cleared to start again. We start very easy first by doing just active range of motion activities, and I'll explain what those are. And then if that's okay, we can begin doing strengthening. So on this next slide, we'll talk a little bit about sorry, gotta go back. I'm actually just gonna demo some of the exercises that we would do. So you've gotten the okay to clear yourself for therapy. You've been in the splint for a while. The first thing I usually have people do is just some thumb motions. It seems very simple, but honestly, if you have this injury, it can be a little challenging. So the first one is just going down and up with that thumb. Again, this is kind of keeping the tension on those two tendons that run up into that thumb. Another thing that we can do are just some thumb circles going both clockwise and counterclockwise. These are all those active range of motions that I was talking about before. I also like to throw in thumb ABCs sometimes, so drawing the alphabet out with our thumb. And just so everyone knows, we will be providing all these exercise handouts for you all later on. So if you're having a question of, I can't remember everything, don't you worry about it. We'll be sending you these exercises. So those are all the active range of motion things that typically I start with after you've been allowed out of your splint. But sometimes once we're done with that, we can also start just doing basic wrist strengthening and thumb strengthening. And so one of the things that I have people do for overall wrist strengthening are called wrist curls. So I'm at home currently, and I don't have weights, like little weights. Typically I tell people like 1 pound, nothing crazy, but I don't have a 1 pound weight, but I do have a can, and anything around like 16 ounces would be best to start out. You want to start out nice and easy so you don't overwhelm those joints and the thing and your thumb. So the important part of a wrist curl, just to show you proper form and everything, is to put an elbow on the surface that you're going to use, and then that wrist is far enough off the ledge so you can do a full down and up. Because if you were too close, you'd bump into something. So you want to make sure you have a good ledge to come on and off of. So just going down and up, nice and slow. You don't want to go too fast because then the muscles aren't working right. So you really want to go nice, slow and controlled movements. You would do this way with the palm facing down towards the ground, and also palm up towards the ceiling. Again, just going nice and slow with it. And then also in this hammering motion that we were kind of doing earlier before, going up and down, again, nice and slow. And these should all be done without pain. If you are experiencing pain, that's definitely something you want to stop doing and talk with your therapist or your doctor about. So that's pretty much D. Quervain's in a nutshell. There's a lot more information. So if you do have more questions, feel free to reach out to us. But Ayelen is going to take it from here and talk to us something about the TFCC.
Hi, everyone. My name is Ayelen, and I'm one of the occupational therapists at 95 Chambers Street. And today I'm going to be talking about the Triangular Fibrocartilage Complex, also known as the TFCC. And so a little anatomy about the wrist. So on this side towards the pinky, it's called the ulnar side. And then towards the thumb side, we have the radial side. And so the TFCC is one of the primary stabilizers of the wrist on this pinky side, and it's composed of various ligaments and cartilages as shown in the picture below. And often these injuries can occur due to trauma, such as falling on the hand or repetitive loading or stress from weight bearing and overhead lifting. So weight bearing activities can include, planking or trying to sit up from the chair or up from the bed. So those are weight bearing activities. And this area tends to be avascularized, which means that it doesn't receive much blood circulation, meaning that it can take longer for it to heal. And so I'm going to talk about some of the common symptoms on the next slide. Obviously, some of the symptoms that patients experience are that ulnar-sided wrist pain with ulnar deviation, so deviating towards the pinky side, and then supination, bringing your palms up, and then weight bearing again, placing your hands against something. And so some of the ways that we can test for this TFCC injury is, palpating around that ulnar side to see if there's any tenderness or pain. We also have this other test called the compression test, which I will demo later, the lift-off test, and the weight-bearing test. And I'll be demonstrating some of these tests right now. So with the compression test, we usually have the patient in neutral position, and the doctor or the therapist will kind of squeeze the two bones together to kind of provide some support. And then they would try to ulnarly deviate, so move towards the pinky side. And then if there is pain, this might indicate a TFCC injury. And then we have the lift-off test. So we ask the patient to bring their palms up, and then we have them place it under the table and then attempt to almost press against it or lift off. And if there is, again, pain or discomfort around that ulnar side of the wrist, that pinky side, this can also be an indicator of that TFCC injury. And again, as I mentioned before, that weight bearing, so like against the floor or even attempting to push off of a chair can cause some of that pain. So we often have the patient weight bear against something hard. I don't know if you can see this, perfect. And then we'll have the therapist kind of provide support on that ulnar side, that pinky side. And if that decreases the pain, this often indicates a TFCC injury. And so with these tests, I would definitely recommend having a doctor or a occupational therapist who specializes in hands to try this before attempting to do it yourself. And then I will talk about what the treatment looks like for this type of injury. And so the treatment usually depends on, the type or stage of injury, as well as the functions that are affected. So the doctor may recommend ulnar gutter splint, like you can see in the picture on the left side, which prevents some of that rotation and deviation of the wrist. And then a wrist widget is also helpful in reducing some of that wrist pain associated with the gripping and wrist rotation and the weight bearing. And then I often also use taping, like with a K tape on that ulnar side. This doesn't limit any of the range of motion, but it provides a cue for the wrist to limit any of those motions that causes the pain. And then we definitely educate the patient about, the anatomy of the TFCC, as well as modifying some of these activities so that you can reduce the pain as much as possible. And then some modalities that are helpful are, using heat, especially after immobilizing the wrist for so long, it could get pretty stiff. So we usually recommend heat before the exercises. And then there's also icing it usually helps to kind of decrease the pain and the inflammation. And in the next slide, I'm going to be talking about some of the exercises. So again, like Courtney mentioned, we usually start off with active range of motion. And then once that is pain-free, we usually progress into grip and wrist strengthening. And I'm going to be demonstrating some of these activities later. And then we have the proprioceptive activities. And these are typically included in our treatment sessions because it provides stability of the wrist by kind of reteaching that joint where your body is in space and in motion. And then I also like to include some proximal strengthening. For most of my patients with this type of injury, weight bearing is one of their goals. So in order to kind of reduce some of that load off the wrist, we like to strengthen what's going up here. We have this saying in OT world, proximal stability equals distal mobility. So, strengthening up here can get a lot more mobility down here. So I'm going to be demonstrating some of the activities that we do. So as I mentioned before, we start off with active range of motion, and that might just look like, some wrist flexion and extension and just some ulnar and radial deviation. And then once that is almost pain-free, we can kind of go into strengthening of the wrist. So I often like to use a hammer. I think everyone has this in their household, so it's a good exercise. And again, with these exercises, if there's any pain, I would definitely refrain from continuing with these exercises and definitely consult with a physician or reach out to one of us. So for strengthening, we can often start off with isometric, which is keeping that muscle length the same. And I often ask the patient to kind of provide resistance on one side, and then you resist, and then provide resistance on the other side. And that's working on strengthening that supinator and pronator, which helps you bring your palm up and down. And then once that is pain-free, we can definitely go more into active range with strengthening. So patients can often start off with small arcs of motion of supination and pronation with the hammer. And then that's pain-free. We can go a little bit more deeper into that supination and pronation. So this is a really good exercise for strengthening that supinator and pronator, just creating more wrist stability, some more wrist stability. And then some of the proprioceptive activities that I like to include. I'm at my clinic, so we have a lot of fun tools here. This is called a wrist balance, true balance. And it's a good way to just kind of reteach that joint where your body is in space and just creating more wrist stability. So this is a really good exercise. And if you're at home, I sometimes have the patients, get a plate and then a ball and have them kind of like roll the ball around the plate. And it's just a really good exercise for creating more wrist stability. So that's a really good one. And then another good home exercise would be just getting a glass of water and then having the patients swirl one way and swirl the other way while trying to keep, not like me, but trying to keep that water in the cup. So those are all just really good exercises to create more wrist stability. And so next, Courtney is going to be talking a little bit about the distal radius fracture.
Hi again, guys. So now we're going to be talking a little bit about what's called the distal radius fracture. It's honestly one of the things that I see most commonly in the clinic. It's what people call a wrist fracture sometimes, or a broken bone. But what happens is we have these two bones in our forearm here. So we have what's called your radius that goes down into the elbow, and your ulna. Typically, this distal radius fracture, meaning distal meaning a kind of further away from your body, or like from your heart. So typically it's a fracture kind of right along here, and it can wrap around the front, but it's usually around the thumb side of your forearm. It's one of the most common upper extremity fractures, and it typically happens when you're falling and you go to catch yourself, and the first thing you do is just bring your hands out like so to catch yourself. It's a protective response that us humans should have and need to have, but sometimes it causes us to have injuries like a distal radius fracture. You can have a little bit of an ulnar fracture with a distal radius fracture. They won't typically label it as an ulnar fracture unless it's just the ulna. Depending on the severity, it also includes whether or not the ulna was fractured as well. But the two work together. In your forearm, there's a little membrane that sits right between the two. And when one moves, the other one kind of tugs on the other. So a lot of times I have people who say, I have a distal radius fracture, but this ulna side hurts worse than anything. And so it can be caused by that as well. But typically it's pain onto the thumb side of our forearm. And when you have a distal radius fracture, this is something definitely you want to talk to your physician about. Go get an x-ray because that's the best way to see if your bone is actually broken or not. And they can definitely see what the next steps would be. So on our next slide, we'll go over some of the symptoms and the treatment timelines of a distal radius fracture. So first sign typically is pain at the wrist, makes sense, but you can also have a lot of swelling in the wrist and sometimes even into the fingers. So it's very common just to feel really stiff and swollen, and you just don't feel like it's normal. You'll also sometimes have decreased range of motion, meaning you can't move it back freely as much as your other hand you could, or, and all these different positions that our hands go into will be definitely difficult. It will also be really difficult to grab things and hold on to something that's heavy. And you'll also, sometimes people even have a numbness or a tingling sensation that radiate down into the fingers. So given the severity of the fracture is really going to determine what your treatment is going to be like. So typically you will be casted in a cast for about 4 to 6 weeks, or you might have been in a splint. Some people do need, unfortunately, to go get surgery to realign the bones. So it really just depends, and that's why it's really important to talk to your physician and get an x-ray to make sure that you're getting the best possible treatment. Once you're out of the cast, though, we do have this very specific timeline of what we can and shouldn't do with our bones because they're still actively healing even after you get out of the cast. So typically about 1 to 4 weeks after the injury, we only do what is called active range of motion, which I've gone over, and so has Ayelen, but it's just that what your body can do naturally. And then we can go into passive range of motion around week 5 and 6. Week 8 is when we typically start introducing some of those wrist curls and the strengthening. And then around week 10 to 12 is when we start doing that, putting some weight into the wrist. So like push-ups or putting yourself out of a chair. That's all that kind of weight bearing that we would do. If you're a big yoga person, that's something that we would want to wait for a little bit before we start doing those exercises. So to talk about more about exercises, I'll first kind of list out some of the things and then I'll demo them. So like I said, when you're finally cleared for therapy, your doctor will have very specific instructions of what you can and can't do, depending on what's going on. So you have your active range of motion, our passive range of motion, exercises, and our strengthening. So I'll go ahead and start demoing some of the things that we can do. So, like Ayelen had already mentioned, we would first start with active range of motion, which is just going kind of back and forth with that wrist. What can it naturally do? Don't push it, just let it do its thing. This is called flexion, and this is extension, just kind of going back and forth. Depending on where your fracture is, it might be more painful in extension or more painful in flexion. Another thing that we have you do is what's called supination and pronation, so like holding a bowl of soup and going down towards the ground. This motion is typically pretty difficult and stiff when you have a distal radius fracture. So it's very common to have, a limited range of motion. So you might be here to here, and that's all you can do, and that's fine. That's all we want you to do first. And then lastly, that ulnar and radial deviation, kind of just going back and forth of that wrist, up and down. I even like to throw in a little bit of wrist circles to get the whole wrist moving. And just like I did with the thumb ABCs, I sometimes also do with the wrist ABCs. So drawing that alphabet A through Z and going through all the different letters that we have, uppercase, lowercase, it doesn't matter. It just all helps move the wrist in the different motions. In terms of passive range of motion is when the wrist is not moving technically, but you're resisting kind of like a force and trying to get a little bit of a stretch. So a couple different wrist stretches that you can do, and you're feeling like you're really stiff, even if you don't have a distal radius fracture or you just feel like a really stiff wrist. These are really good exercises. The first one, what you want to do is make a nice long arm, keep that elbow nice and straight. You're going to let that wrist go down, and you'll take your other hand and apply again that small little force, not too crazy. You don't want to go heavy with it, especially if you just had a fracture. There's a very light push into flexion and holding there for a good 20 to 30 seconds. Allow those muscle fibers to really break up that stiffness. If you do anything shorter than that, it's not going to give them enough time to really relax. You would do it both in flexion and extension. So going around into the hand, pushing. I don't like to have people go into the fingers because then they can hyperextend, and that's not great for those fingers. So really just try to go into the palm and just pushing back and holding again for those 20 to 30 seconds. Really allow those muscle fibers to relax. Another way that you can do this exercise is called the prayer stretch or the reverse prayer stretch. So the prayer stretch is when you bring these palms together and you're going to try to lower them down into your chest. And again, you want to keep the palms together. If we start doing this, then we're not getting enough of that wrist extension kind of going back. So we just hold here and again, allow it to really stretch out those muscles. So hold for a good 20, 30 seconds and then relax. You can also do what's called the reverse prayer stretch. Is when you go like this and you bring those elbows down, trying to get a little bit more of that flexion. And again, you would hold this stretch for about 20, 30 seconds, allow it to really break up those tension fibers. And again, if you're having significant pain with this is something you should not do. And so just be mindful of your body and listen to it. This isn't a no pain, no gain system. It is listen to your body and figure out what it's telling you. The last passive range of motion that I like to do with people in the clinic or people who are going at home is to do what's called a low load prolonged stretch. So typically a low load, meaning like a couple pounds and over a long period of time, really allows for gravity to kind of do most of the work while you're just hanging out. So I'll demonstrate what I mean with a bag of rice. So I put a couple really like a half a pound of rice in here. What I have my patients do if they're super stiff in deflection and extension, I just literally tell them to put that bag or that little poundage and just let them hang out and let gravity do the work. Let gravity pull you down and more into flexion. Let it relax and stretch out those fibers. You should feel a stretch, but not pain. Same thing with extension, kind of holding back and just letting gravity do the work and holding for about 3 minutes. I wouldn't do much longer than 5, just because of the nerves that run through our wrists. You can run into other complications. But like I said, you definitely just want to have the advice from your therapist or your doctors before doing anything. And other things that we can do to strengthen, just like we mentioned earlier, those wrist curls going down and up, nice and slowly, right? And also go in the other way. And then lastly, that other motion right there. And Ayelen already showed a perfect example of working on that supination pronation, because supination and pronation tend to be one of the harder things to get back when you have a distal radius fracture. I have a mallet here at home, so I would just do that. I always tell people I would start off really easy by the head of the hammer. This makes it the weight less. And once you start getting stronger and stronger, you can go all the way down to the end and really strengthen that supination and pronation. Lastly, what I was talking about, the last thing that we typically do is what's called weight bearing, or putting some pressure into those wrists. So doing planks and push-ups and stuff like that. We don't want to start right away going into a high plank or a big push-up. We want to load the bone because it's still healing slowly. So typically I start people off with doing some push-ups on a wall. So I'll just demonstrate real quick on this wall over here. So I have people stand really close to the wall first, and they're just going down and up. This would be like very easy to the normal wrist, but very challenging for someone who just broke their wrist. Once they're done with a wall and they think this is good, you can then lower the area of where they're going to do their push-ups. So I have like a counter right here. This would add a little bit more pressure onto those wrists, right? Going down and up, nice slow and controlled motions. And lastly, I would then start doing like modified push-ups on your knees and then full push-ups into the high plank position when that wrist is ready. So really you just want to do progressive things, start really light, listen to your body and see what it's telling you. But I do recommend definitely getting cleared by the physician and having a treatment plan in place by your therapist and physician. So that's the distal radius fracture. And Ayelen is going to talk to us a little bit about a ligament injury called the SL ligament.
All right. So the next common injury that we see is, like what Courtney described, is the SL ligament, also known as the scapholunate ligament injury. And this is one of the most frequent forms of carpal instability. So a little anatomy about the wrist. As we both described before, we have the ulnar side where the ulnar runs and the radial side where the radius runs in the forearm. And then we have the 8 carpal bones. So we have 4 right here and 4 above it. And then by this thumb, there's this divot that you'll feel in the anatomical snuff box we call, is a scaphoid. And then right next to it is the lunate. And so there's a ligament that connects these 2 bones, and that's the ligament that we're talking about, the scapholunate ligament. And so a sudden force to the hand, such as falling on the hand, can cause some of that ligament laxity or injury, creating some of that wrist instability and decreased mobility. And an SL ligament injury can also occur with a scaphoid fracture, so that scaphoid bone right there, or a distal radius fracture as well, which is the injury that Courtney talked about earlier. So some of the symptoms that we'll see in the next slide is pain on that dorsal, so the back of the hand, so back of the palm, and the radial side of the wrist, so towards the thumb. And then there's some increased pain with, some of that wrist extension, so bringing the wrist back, and some of the radial deviation, so moving towards the thumb, and weight bearing, so applying pressure against a surface. And one of the ways we can test for a SL ligament injury is the Watson's test, which I'll be demonstrating right now. So what the therapist would do is apply pressure on that scaphoid bone. And we would start off in ulnar deviation and extension. And then the therapist would attempt to bring the wrist forward towards the thumb. And then they would release that pressure off that scaphoid bone. And if there's like a clunking sensation or any pain, that often indicates a SL ligament injury. And so I'll be talking about the treatment on the next slide. So again, the treatment really depends on the degree of the injury. The physician may recommend a splint, the forearm-based thumb spica splint that Courtney showed earlier, the Quervains, just to keep the wrist immobilized and just to protect it. And some of the modalities that you could use are ice to kind of decrease the swelling and the pain. And then we would definitely use heat before the exercise just to warm it up, just because you were in that splint for a while. And then again, we would educate the patient about activity modifications. So we wouldn't recommend any lifting heavy items or weight bearing till the consent of the doctor or till the therapist recommends it, to prevent any like further stress on that ligament. And on the next slide, I'm going to be talking about some of the exercise that we do in this session. So we typically start with the dart thrust motion, which research shows that it is a safe way to kind of start range of motion without disrupting the ligament. And in this direction, there's less movement of that scaphoid and lunate compared to like the other wrist movements that we typically do, like the wrist flexion and extension. And then we would go into active range of motion that Courtney briefly described, and then kind of progress into wrist strengthening. And then I would include a lot of proprioceptive activities to help with the stability of the wrist. So I'll be demonstrating what the exercises look like. And feel free to follow along, but if you are experiencing any pain, I would definitely recommend stopping the exercise and definitely consulting with the doctor or reaching out to one of us. So the dart thrust motion looks like you're throwing a dart. So you can start with a pen, just go back and forth. And then sometimes I even like to progress using a weight, like a 1 pound weight, if that's not painful. And so this is just a good way to kind of initiate that range of motion. And then after that, I would definitely do some of that active range of motion, moving the wrist back and forth like Courtney described. And then we would definitely start strengthening that wrist, with the wrist curls. So wrist flexion, extension, some of that radial and ulnar deviation. So those are some good exercises for strengthening the wrist. And then we would do some proprioceptive exercises. So like I described earlier, we can use that true balance for a good wrist stability exercise. And then we have this fun little tool over here called the slosh pipe. It's this long pipe filled with water. And what I would have the patients do is kind of hold out their arm while stabilizing the slosh pipe in their hand, and then hold it there for 30 seconds. And it's just a good way to create more stability of the wrist, kind of reteaching that joint where your wrist is in space and in motion. Yeah, so if any of these activities are causing any pain, I would definitely, again, recommend consulting with your physician or reaching out to one of us. And so I hope this information was valuable, and I'm going to invite Courtney and Phalo to join me on the screen for the Q&A.
Wow, that was great, guys. Great presentation. So much information. I'm absorbing it all, and I love the exercises. So we're going to go on to the Q&A portion, and we have a lot of really good questions. And so I'm just going to go down the line, all right? And the questions are pouring in. So, and you can choose who wants to answer it, take turns, whatever you want. But I have some questions too. So this is a good question. Someone asks, how long does the client or a patient do the exercises? For example, 5 minutes?
I would.
You can go ahead.
It really depends on the injury, but typically with the exercise, I do give my patients, we say 3 sets of 10 for each of the exercises, and one daily, so once every day. Mhm.
Okay, great. And then here's another question. What are your thoughts about using a gyroscope?
Oh, interesting. If you have one at home, it can be a great exercise to do proprioception. Like Ayelen was talking about before, we have that slush pipe or the true balance or that tennis ball on the plate. A gyroscope would do the same thing, trying to just mimic that same motion of trying to get a little bit of wrist stability into that wrist. So feel free, if as long as it's not causing pain, that's a good way to do it as well.
Excellent. Here's another question. And I think, Courtney, you got into this, but I'm going to ask it anyway. Are push-ups weight-bearing?
Yeah. Weight bearing is typically anything that you're going to put a force into that wrist, that pressure onto that wrist. So it can be push-ups, it can be a downward dog, it can be getting out of a chair and you go to push yourself out of it on those armrests. Anything that's going to put pressure onto those wrists is what's called weight bearing. And that's something that, if you're having a TFCC injury or a fracture, we want to make sure we're doing it properly and safely.
Great. Thank you, Courtney. Someone else wrote in that they have an SL injury, the ligament gone, bones held together with a screw. Are any exercises for this condition?
Really depends on what stage you're at, but I think what a great exercise that I mentioned earlier was like that dart throws motion, just to initiate that range of motion. And then if this is pain-free, you can always kind of progress, adding more weights. Like I use that 1 pound weight. So this is also often a good way to kind of start that range of motion. If that's pain-free, do some of that active range. But again, this also really depends on the stage of the injury. So I would definitely recommend consulting with a physician and an occupational therapist before continuing with any of these exercises.
Thank you, Ayelen. Someone else had a question. You guys mentioned splints. So for various conditions, where would a patient get a splint if they needed one?
So anyone who's trained in splinting, it can be a PT or an OT, anyone who specializes in hand therapy are typically trained in also splinting. So you can buy prefabricated stuff on the line, on Amazon, but a lot of times to do splinting, it's great because it's actually molded to your own form, so it's customized just to you and your body. So any of our occupational therapists or a hand specialist would be able to do that for you at any of our locations, well, all of our locations that have OTs or a hand specialist.
Great. And a lot of times too, you need a prescription from a doctor before you get the splint. So if the doctor requires, say you have a TFCC injury, he wants an ulnar gutter, you can call one of our offices and then one of the hand therapists can make that for you, customized. Thank you, Courtney. Here's a question about, do you guys deal with patients with long-term tendinitis trying to avoid surgery?
Yes, we do. But I would definitely reach out to your, physician before coming to us, just to see, just for them to check out how everything's looking and if they do recommend going to a therapist.
Great, thank you. And can you guys explain, long-term tendinitis sometimes turning into tendinosis? Can you just talk on that a bit?
Yeah, so tendinitis, anything that has an itis is an inflammatory response, meaning that you're having inflammation and swelling of the tendons or muscles. Tendons are what connect our muscles to bones. And so tendinitis is typically an inflammation of those tendons and a tendinosis. Oh my goodness, tendinosis. The other is when you're having a narrowing of the space of where those tendons run through, or the tendons themselves. And so it can be definitely a challenge. And a lot of the times when I do have these tendonitis patients, I try to recommend, what is your ergonomic setup at home? What is something that maybe is causing this tendonitis to continue? Because there's probably something that is often making that tendonitis a little bit worse. And so definitely want to discuss that with your physician or therapist.
Thank you, Courtney. Yes, and also tendinosis it's a long-term tendonitis, and it's a damage to the tendon. So sometimes there is something we can do, but the tendon damage sometimes cannot, be healed or healing on its own, which a tendonitis can be. Thank you. Perfect. And then, here's a great question. Is it helpful to use your fists instead for weight bearing?
Yeah, if you are experiencing any pain with weight bearing with like your wrist fully extended against a hard platform, I would definitely recommend the wrist because it's keeping that wrist in neutral, so it's not providing any like load on any of the different wrist movements.
Another question, they're just pouring in, guys. If the injury is more than a year ago, is it too late to go to OT/PT?
I think it depends on what it is, what's going on, but I think if that's something that you would like to explore, something that you'd want to talk to your physician about, I don't think going too late. There are some things like if it was malaligned, the bone or something that we couldn't fix as a therapist, right? We can't refix the bone and how it looks, but there are some things that if you're continuing to have pain up to a year, definitely explore that option. I think it's a valuable thing to try. Why not try something that might help you in the long term?
Another question, what pain level should the patient be looking out for to stop exercises?
I think Courtney mentioned a good point is listening to your body. So if anything's causing any sharp, acute pain, I would definitely refrain from doing the exercises. And if you are continuing to experience a pain, I would definitely reach out to one of us and consult with one of us to get to know what might be causing that pain.
Great, thank you, Ayelen. And also swelling, bruising, any black and blue near the site of the injury, intense swelling, redness, these are also signs that you should go to a doctor. Can you advise on a good wrist protector while lifting weights? I have pain from heavy lifting.
There are definitely some, I don't have one specifically that I use or tell people to use, but you just want something that will be protective and kind of add that extra support, whether it be like a wrist widget, if you're having a TFCC, depending on what it is exactly where you're having the pain, you might want to try a different type of, either you can do KT taping a specific way, or you can do a wrist. There's not one that I would specifically tell people to get, kind of really just depends on what exactly is painful about it, what side of it, and such forth.
Okay. I'm not me, but this is the question. I'm doing a lot of note writing for school, wondering if stress balls or Chinese metal rolling balls are good for exercise/relief.
Yeah, so if you're feeling a little tight around this area while you're writing, we also have this little wine corks at our clinic, and we kind of it's like a little foam roller for that thenar eminence, like that muscles around the thumb. I sometimes like to use that to kind of release the muscles in that area. And then some of the wrist stretches that Courtney gave, those are some good ways to kind of reduce some of that tightness going on. And again, you just hold it for a couple of seconds, not too long. And then again, with the foam rolling, I wouldn't recommend doing for more than a minute or two.
Yeah, I think Phalo is grabbing a cat toy because those are also really good.
Right. So it's like a foam roller, if anyone's ever done a foam roller, and you can use it right in that area. So it's very comfortable right in that thenar or thumb area, which is often tight. And you can roll it against each other or on the table, rolling it on the table if you want as well. Great questions. Here's another question. What kind of doctor is best to consult for wrist pain?
So there are orthopedic surgeons that are typically specializing in the hand. There are some that specialize at elbow down, some just do wrist. So I would definitely reach out if you have a question of who you should go see or anything. We can definitely help you with that. But I definitely would recommend someone who specializes in the hand and wrist if you're going to be having pain in there, because they're just a very complex thing. And so you want to make sure you have the best person on your team.
And if you do need a referral to a doctor, all of us have very good relationships with the hand doctors in New York City. And so we can definitely point you in the right direction because we work very closely with a lot of them.
Mm-hmm.
What do you do if your joints or fingers hurt, especially the thumb joint?
Again, I would definitely recommend, I'm not quite sure like what kind of thumb pain you're experiencing or what activities are causing some of that pain, but I would definitely recommend, reaching out to us or a doctor for further consultation.
Sorry, I'm just scrolling through the questions. Wait, there's one more. Hold on. These are such great questions, everybody. And I think it was, again, the presentation was so good that it generated all these questions. One more question's coming in, and then we might have to be wrapping up soon. But if you have other questions, you can reach out to us. Okay. Here's this is probably gonna be the last question, guys. But fracture 7 years ago with plates and screws in it. Is it normal to have pain? And would PT/OT help this far out?
7 years ago, that was a long time. Depending on what you're feeling, is it pain when you're in weight bearing? Is it pain when you're moving? I think if it's been 7 years, that's something I would definitely want to recommend talking to a physician, seeing maybe perhaps if there's something with the hardware that is causing pain on a nerve or something. We definitely want to get that checked out with x-rays or an MRI to see more in depth of what's going on if it's been that long. But most commonly, I think you would want to get it checked out first and see what's going on before starting PT or OT, depending on what you're kind of feeling.
Got it. Great. Excellent. So I think that's it for questions. There were so many good questions, and thank you again, everyone, for watching. And I'm just going to do kind of the closing blurb and stuff. And again, thanks everyone for watching and the contribution. So we hope today's talk was valuable and that you learned more about, common wrist injuries and some treatment methods and lifestyle modifications and exercises to manage and improve these symptoms. If we didn't get to your question, we will do our best to reach out to you directly afterward. We'll also be sending a handout after the webinar with a recap of important facts as well as exercises for you to have as a reference. Now, as a reminder, your presenters today were Courtney Nilson and Ayelen Lee, who are both OTs at 84th Street and Chambers Street, respectively. Please feel free to jot down their contact info so you can reach out to them directly with any questions and or schedule an appointment. Our Q&A moderator was Kathleen O'Donnell Pickert, and she's an OT. And again, she's kind of does a lot of telehealth. So again, you can reach out to her. And she has a lot of experience, and she could, if you want to do kind of a remote session, she's great at that. And I'm Phalo, I'm the director of the hand program. I'm out in Brooklyn and Park Slope. Feel free to reach out to me as well with questions. And at Spear, we do treat in a huge array of conditions from head to toe. So all of us who presented are kind of specialists in the hand and the elbow, but we have other therapists who treat the other body parts. We're open for in-person visits as well as for telehealth sessions. Should you feel that you could benefit from some individual guidance and treatment, please don't hesitate to reach out to any of us. And lastly, we will be continuing to be hosting webinars throughout 2021. So we're going to be covering a variety of topics, and we look forward to seeing you there. So please follow us on social media and or check your inboxes to learn more about upcoming topics and the schedule. And I just want to thank all of you guys for spending time with us today, and we hope you enjoyed